Hey everybody, and welcome to the Student Physical Therapist Insider Access page. Today I want to talk to you a little bit about my hesitancy regarding prescribing hamstring stretching for different patients, particularly because I think that they're inconsistently diagnosed with hamstring tightness when more so it's a neural tension aspect. So first of all, when differentiating between the two, I would like to do either a passive straight leg raise or a slump test. So when you're doing the slump test, if you have them in that position, slouch posture, head down, and they straighten their leg and feel tightness, and it increases, if the tightness is in the hamstring, and if it increases when they dorsiflex, we know that there's a neural tension component. Now, if you're doing a passive straight leg raise, when you lift the leg and they feel the tightness, maybe it's in the posterior thigh, if you dorsiflex and it increases, again, maybe there's a neural tension component. So let's say hypothetically a patient has both neural tension and hamstring tightness. The reason why I hesitate to prescribe hamstring stretching is because most people, when you get them into a hamstring stretching position, will get either they'll sit on a ledge like this, put their leg out and try and bend forward like that, or maybe they'll be on the ground or on bed or something, and same thing, they're reaching. Notice all the lumbar flexion there. So when you're doing that, you're almost biasing it towards a neural tension. And the concern with that is that the longer that you constrict and stretch a nerve, the more that it decreases blood flow to that region, and either it has a negative effect or has no positive effect. This applies particularly to your patients that you've seen trying to stretch their hamstring for years and years and years, never made any progress. Meanwhile, if you try and address it from a neural tension aspect, then you'll see pretty much immediate improvement. Now, it might not be complete resolution because there may still be a hamstring tightness aspect underneath, but the superficial layer at least has a neural tension component. So the way that I recommend addressing issues like this is first do something to address the neural tension component. So that could be a thoracic manipulation, a lumbar manipulation. You could do some eye stim to the lumbar paraspinals or the posterior lower extremity, maybe some dry needling. All those or other things can improve the neural mobility. From a more active aspect, you can have them do some nerve glides themselves. So get into that slump position and maybe do some ankle pumps while feeling the tension there, and then progress through more mobility. Once they've established that they've improved their neural tension, then you can try and proceed to a true hamstring stretching exercise. And so what I recommend to make sure that I'm not encouraging neural tensioning is I'll have them make sure that they keep a neutral lumbar spine and then straighten out the lower extremity and then try and hip hinge from there. And you want to hold that at least 30 seconds. I try and shoot for a couple of minutes, but it should be a prolonged stretch, but not so much intensity that the patient starts to guard and again becomes neural tension. Another method of doing it is having the patient in supine and using a strap around the lower extremity and just lifting the leg. Again, that avoids the lumbar flexion position. And that's so important because when the patient goes into lumbar flexion, you are again tensioning the nervous system. So really try and isolate the difference between neural tensioning and hamstring tightness when you're trying to treat these patients, and I think you'll see a lot more progress.